Hi, hello, welcome to Shanmuga's podcast. Today we are going to discuss about a very interesting topic on lung health and a particular lung disease which is very rare. And for that we have joined with Dr. Shika, our pulmonologist today. Hello ma'am, how are you?
Hi ma'am, good ma'am, how are you ma'am?
I'm fine ma'am. So of late I have been thinking about a lot of pigeons which has been increased over years in Salem, which has been observing visibly.
Yes, ma'am.
So I feel that the pigeon-related lung disease would also have gone up a little high due to it. And so if it is, what is the particular disease which is affected due to pigeon?
Like you said, pigeons along with other birds are a significant source of allergens that can affect lung health. The thing is, a few amount of proteins which are seen in the bird droppings and the feathers can cause inflammation in the lung tissue. And the most concerning condition that it leads to is called hypersensitivity pneumonitis.
So it does affect the lower respiratory or upper respiratory. What are the symptoms of this hypersensitive pneumonitis, if you say that?
Hypersensitive pneumonitis is a disease which affects both the lung parenchyma and the airways. When you come to symptoms, initially the patients are going to experience mild symptoms like cough, which can be dry or with scanty expectoration, fatigue and tiredness, and also mild breathlessness also. So mostly initially they'll mistake it for a normal common cold or an upper respiratory infection. But as the disease progresses, they are going to have more severe symptoms or serious symptoms like wheezing, chest tightness, which they may perceive as chest pain, and also breathlessness, mainly on exertion, which progresses over time.
So if the respiratory symptoms which mimics the other common disease, as you said, as cough and breathlessness, is there any particular thing which the patient should be aware of so that he comes and visits the doctor early for help?
The most important factor in this setting is being aware of your exposure. The most of the time what happens is the patient comes to us with these symptoms, and only when we probe multiple times, they are even thinking, okay, yes, I have this type of specific exposure. So being aware of your surroundings is very much important, and that is exactly why such a discussion is important, ma'am, so that the public gets aware that such an exposure can lead to such and such a disease. So there is no specific symptom to pinpoint that if I have this, okay, I may have hypersensitivity pneumonitis. So if you have any of the respiratory symptoms and you are aware of such an exposure, it is always better to consult your physician earlier.
So why this pigeons related disease you think is common in our place?
So in India, we know that pigeons are found abundantly everywhere, even in both rural and urban settings. In rural areas, they are found mainly in farms, and in urban or semi-urban setting in multi-storied buildings like apartments and office buildings. Another most concerning factor that has led to an increase in the incidents in the past years is the local public who feed the pigeons in open spaces like parks or streets and even their terraces of their homes. And some activities like pigeon breeding has also led to an increase. So in some of the cities like Mumbai and municipalities like Delhi, they have actually brought in local laws to curb such activities.
Oh good. So since they have a rampant amount of pigeons in Mumbai and Delhi, you said they have enforced a law, but for us, since we are in the starting stage, there is no law enforced. So what we can do better for people to be aware to prevent contact with the pigeons?
Physical exclusion from these birds is of utmost importance to control the disease, ma'am. So if you're living in apartments or if you're working in office spaces, using wires or nets for your windows or balconies can help in keeping the pigeons away. And using reflecting objects like mirrors or having wind chimes, streamers can also help in acting as effective deterrents to keep these birds away. Always ensure that you keep your balconies and your living spaces clean, and if you are living in an area where there is a chance of exposure, while cleaning, make sure that you are wearing protective equipment like gloves, apron and masks. Also the same applies for those working in farms. It's always better to have a mask, even a normal cloth mask, to act as a physical barrier will help in decreasing the exposure to these.
So the term that hypersensitive pneumonitis is allergic reaction to antigen.
Yes, ma'am.
So is it only the pigeons causes this, or any other allergens which the public should be aware of so that they can avoid contact with those also?
Like you said, ma'am, hypersensitivity pneumonitis is a disease condition which is causing inflammation in the lungs. So this can be secondary to exposure to both organic and inorganic components. So the most common organic dust exposure which can lead to this are, like we said, bird droppings or feathers. Others are cotton dust, hay and molds. These are the most common organic. And in inorganic, what we see as spray paints, glues and even some laboratory reagents for that matter can also lead to this condition.
So as you said, ma'am, the symptoms is also very common for other respiratory diseases. Other than the contact history, we don't get to know particularly whether they have this illness. So how do we tend to diagnose these patients?
So when these patients come to us, diagnosis often involves a detailed history which includes the history of exposure, the duration of exposure, the extent of exposure that these patients have had. And following this, we'll be going ahead with imaging like chest x-ray, CT scan of the lungs, along with blood investigations and lung function testing. Some of the patients in whom the diagnosis is uncertain, they may even need lung biopsy to confirm the diagnosis.
So you have done the diagnosis. Now the patients, we don't know which stage they are. So as per the stage, the treatment varies, or how do you start with the treatment protocol?
Once the diagnosis of hypersensitivity pneumonitis is made, the most important factor in the treatment is obviously complete avoidance of further exposure to the particular trigger which the patient has. And after that, the medications usually aim at decreasing the inflammation in the lungs, especially in the early stages. So for that, your doctor will be prescribing corticosteroids or steroids with proper monitoring. As the disease progresses, the patient is going to develop lung scarring or fibrosis. So our main aim in treatment will be prevention of further progression of the fibrosis. So medications aiming to that will be like antifibrotics will also be added. These patients who have progressive disease will also be put on will need long-term oxygen therapy, which they need to use at your homes also. And as a last resort, lung transplantation may also be needed by these patients.
Of course, that's severe that the final cure is only the transplant.
Yes, ma'am.
So if it is so, if they find this disease in early condition, the prognosis will be better.
Definitely, ma'am. In the early stages, if you are starting the treatment, most of the lung damage can even be reversed as opposed to the later stage or fibrotic stage of the disease, because lung scarring mostly cannot be reversed and they may go on to need lung transplant also.
So now we understand that the basic is lung health. Lung health is very vital for any disease and to prevent the severity of the disease. So what is the general advice you want to give for the public to preserve their lung health and small things which they could do to make their lung happy and healthy?
Definitely prevention is always better than cure, as it is for any other disease that we have. And pertaining to this topic, the first thing is you have to identify and you have to be aware of the exposure that you have. And if you are living or working in a setting where you are prone to such exposures, taking all the necessary measures and using protective gear to minimize your exposure is the first and foremost thing that you have to do. And for that, we have already told what all can be done. Other than that, as a general rule, follow a balanced diet, stay physically active and avoid smoking to keep your lungs healthy.
Oh, thank you. Thank you so much, ma'am. It was a very elaborative thing. We learned a lot about the pigeon-related lung disease. So that the people are aware of and they at least identify they are associated with the risk exposure and they come to the pulmonologist earlier.
Yes,
thank you so much.
Thank you.